This is to increase qi, vital energy.
Qi.
Qi. The best way we can translate that is vital energy, the force of life.
Sort of the life force?
Yes, yes.
So that's what they say this does.
Will it grow hair?
头发可以帮助吗? Maybe. I don't think so, Bill. I've tried it.
This one will. Look at that. Now, what's this one?
这个是什么？鹿角. Deer. These are deer stump of the antler shavings.
What would be a Western equivalent of this?
I don't know. This is a shaving of a deer antler. How often do you find that in the house?
Well, but I mean, do we know what the chemistry is in these herbs?
We really don't. But the Chinese weren't interested in the chemistry as we know it. They're not prescribed because of their active chemical ingredient. They're prescribed because one of them increases heat and one of them decreases stagnation of vital energy. That's the language that they use. It has nothing to do with chemistry. They see the body from a different viewpoint. To them, the body is based on energy, balance. All these herbs, and this is where most of Chinese medicine happens, are prescribed based on this sense of energy in the body. Qi, they call it. Qi. This is what they call the boil the medicine room. That's what it's called.
Boil the medicine room.
This is as close as they will come to an inpatient pharmacy. Each pot has a prescription for one patient in the hospital. Altogether, there are 60-odd pots running at any moment, and every patient in the hospital gets their medicine for the day in these little thermoses.
So what's in these pots?
In each pot will be 10 to 15 herbs for each patient. This whole style of making these herbs is hundreds, if not 1,000 years old, and a lot of these prescriptions are 500 or 600 years old. It's the same prescription they used 500 years ago.
Is the formula written down?
Yeah, yeah.
Each one looks different, too. Boiling roots, boiling gecko, that's more like cabbage and collard greens. This is more like acorns.
What does it smell like to you?
I can't describe it. I mean, it smells like everything I've ever smelled. Tea,
yeah,
gum, raisin, root. You ever tasted it?
Yeah.
When you were here?
When I was here, to understand it, but it is awful. Awful, awful, awful.
I'd heard about operations performed using acupuncture needles as anesthesia. David took me to see one at the finest Western urological hospital in China, Temple of Heaven Hospital.
This is what's called the pituitary cella. This is the area where the pituitary gland sits, and it's enlarged. He's sure that this woman has a tumor smack in the middle of her skull. It couldn't be more central. Okay. And it's very large. 你多大？你可以猜一猜。你给我手看。It's about this big, he's saying. That's a very large.
That's about the size of a quarter.
And what they're going to do is use a combination of some Western medicine and acupuncture anesthesia to perform the whole surgery while the patient is conscious, awake, and able to talk to us. 他们今天要用那个针灸麻醉。
是的。
所以你怕不怕这个？
我不怕，我一点不怕。
They are giving her some, what we would call Western sedative.
Absolutely. And the point here is that she's using less than half of the amount of drug that she would typically use without acupuncture needles. And for many patients, particularly patients at high risk of anesthesia, this has a lot of benefits.
still, I'm going to try and ask her some questions.
你听我的话吗？
这样，
好，你知道他们在，你知道你在什么地方？
手术室
是。你舒服吗？
可以，
很好。不疼吗？
不疼，
I just looked into her brain and saw the tumor, and she's talking to you.
They've opened her skull. She has no pain, and they've used less than half the drugs we'd use in the West.
This must be very strange to you.
Well, I have lots of questions. The professional skeptic in me says that those herbs work because they have chemicals in them, not because they have chi.
Mm-hmm.
And that traditional medicine is a kind of placebo, the power of suggestion. On the other hand, I've never talked to more credible people than those patients in that hospital and the doctors. Yeah. So I have mixed feelings. I'm skeptical, but I'm also, well, I'm open, because I think there is something here that might translate back to our society and be useful to us.
Mm-hmm.
But when you got here 12 years ago, when you arrived, were you skeptical?
Very. I had exactly the same questions.
What was your attitude toward traditional Chinese medicine?
It was really very simplistic. Does it work? And if it works, how does it work? And if it works, how much of it is the placebo effect? Is it just people's belief, or do the drugs work? Do the needles work? Does the meditation work? I asked all the same questions that you're asking. And I didn't know a thing about this qi, this vital energy. In fact, it wasn't until I was in the traditional medical college here for months that my teachers finally drove it home that the whole system is based on this odd thing called qi energy. I came here without ever hearing of that before. This is the acupuncture ward, but these people aren't here for acupuncture anesthesia. They're here to treat all their different chronic diseases.
With needles?
With needles. I asked her if it hurt. And she said it doesn't hurt, and he said, the doctor said it doesn't hurt.
It hurts me.
I know, it's hard to watch. This woman has what we would call Bell's palsy. It's a paralysis of her face. And this doctor, who's been practicing acupuncture for 60 years, is treating her by putting needles in her arm and her face.
Where exactly is he putting them by his light?
He's putting them in what he calls the large intestine meridian.
I don't understand that.
Well, the body in Chinese medicine is made up of all of these circuits of energy.
So the circuit or the channel from here?
Circulates through the whole body and is called the large intestine meridian.
Professor, may I ask you something?
他要问你一些问题。
Can you simply explain this to me? These are meridians?
Yes.
Meridians are channels.
Yes.